I thought this was amazing as you were researching the requirements for emergency rooms, that there is absolutely no central place to get that information. Right to know legislation is very controversial. There's been various kinds of attempts to have right to know legislation in terms of chemicals that we're exposed to, calories from fast food. Well, there's also a patient right to know. You and I have the right to know what consists of an adequate emergency room. Most of the time, if you were to ask people, why are there tons of people sitting in the waiting room? Most people that are in the waiting room would say, because they're really busy. The staff, the doctors are really busy. Well, that's true, because there's only one doctor on duty. I found this out at a recent experience when my husband was brought to a hospital in an ambulance on a gurney. Brought in on the gurney, and there he sat for 10 hours. What I discovered was, as patients were backing up in the lobby, and I'm watching all this going on, and I'm watching the fact that he's laying there for 10 hours, I went up to the emergency room receptionist and said, I'd like to know why in the world we're backed up like this. And that's when I discovered that in order for a hospital to call themselves an emergency room, they're required to keep one physician on duty in the facility. They can have a list of physicians that they can call in if they deem it's necessary. If they don't deem it's necessary, they don't have to call them. Hence, you will wait. Hospitals are profit-making institutions. They're not interested in calling in more physicians to pay out more money. I think that's important for us to know. I also think when you and I walk into an emergency room, we need to have up on the wall what expectations we can have as patients and what we will receive in terms of care.